Narcissism isn't the same as someone who's selfish. Moodiness is not the same as someone who has a bipolar disorder. Having a down day isn't the same as clinical depression. There's a big jump to go from being cranky to being diagnosed with bipolar disorder. And there's a lot of labeling going on and a lot of diagnosing on the internet going on. I think it minimizes the struggle that people who are actually struggling with those issues are going through, but it also makes people believe sometimes that they have a bigger issue than they do, because some things are temporary, right? You may be going through a hard time and feeling like shit. And okay, that's okay. Is that diagnosable? Does that need to be treated? I mean, you need to decide that, but it isn't a foregone conclusion, because emotions change, right? They're fluid and they change sometimes inexplicably, sometimes depending on what you're struggling with. Just be patient with yourself, right? You don't have to find a name for something or get a diagnosis if you're having a transient emotion or an emotion that is completely appropriate to the situation. If you're grieving, yeah, you're supposed to cry and it comes in waves and you'll feel okay one day and then you'll feel terrible the next day. That's how grief goes. If it's prolonged and you are you really struggling and it's getting in the way of your ability to function, yes, then that needs to be looked at. Let yourself feel your feelings, all of them, right? Because there's room for all of our feelings, even the ones that we deem unpleasant. I would say that they're important, right? They're important, not just the happy feelings, but sometimes the sad feelings too. And sign up for my newsletter. Links in the bio.